Our focus today is going to be how local health departments and community coalitions can make the most of the new public health infrastructure and workforce development funding. I'm very pleased to have Carrie Sipp and Nora Murphy-Johnson joining live, and Michael Quinn Patton has just gotten very busy, but we pre-recorded a session that he's going to be sharing, so we'll tap into his wisdom that way. My name is Bill Barberg, and we'll just have Carrie and Nora say a quick hello before we dive into the content. So Carrie?
Hi, I'm Carrie Sipp. I'm the Director of Partnerships, Strategic Partnerships for PACE's Connection. Thank you.
Hi, I'm Nora Murphy-Johnson, and I am the co-founder and CEO of Inspire to Change.
All right, so we are going to dive in here. So the agenda, I'm going to just briefly talk about the pathway to resources for local health departments and coalitions, and then look at 5 ways that we can really grow, develop, and enhance the use of this money that is coming to maximize the impact in the local communities. So the importance of this funding opportunity, most of you are painfully aware of how public health has been underfunded for many years. So there's all kinds of needs. And this $4 billion infusion that states and large cities and counties are working on now is a pretty big chunk of money, but again, it's not nearly enough. So it's very important that we think strategically how to use this money, how to get the most leverage. And of that, $3 billion is dedicated to build and develop the workforce over the next 5 years. 40% of the money that goes to the states will flow through to the local health departments that are not some of the 60 largest cities and counties that will apply directly for the funding. So this means in states and across states, there's an incredible opportunity to leverage collaboration among states and among counties so that you can amplify the impact of these dollars, not reinvent the wheel. And one of the key priorities of this funding is to strengthen community partners in collaboration. Now, this does not mean these dollars will be subgranted to community organizations, but the money can be used for investments that provide strengthening and ways that can really benefit the local coalitions that we'll talk about. So if you're here as part of a local coalition, you'll be learning how you can work with your local and state health departments so you can benefit from this. Because these are not really competitive funding. They're being given based largely on population and a few other factors. So the more you coordinate and share how this money is used, the more benefits everyone is going to get. And that's part of what we'll be sharing about today. So the #1 priority is growing and developing the public health workforce. And they point to the concept of public health 3.0, which was described initially in 2016. And really there was this call to action report in 2020. They emphasize 5 critical dimensions of this enhanced scope of public health. I'm just going to mention that the leadership is so important. System leadership, workforce is key, but also strategic partnerships, because health departments can't address these issues on their own, which is why we want to maximize the leverage we get across communities and among communities. One of the key needs for the public health workforce was highly emphasized in a report that was initially done in 2017 by the National Consortium for Public Health Workforce Development. And this was a who's who of people involved with public health. And they had this call to action, and their #1 emphasis was to elevate strategic skills to be of equal status with specialized skills, and that we needed to have investments in strategic skill development and build systems, not silos, to develop effective and engaging training and creating a coordinating mechanism. Well, as a consulting company that focuses on strategic skills and strategy and community engagement, this was exactly what we've been trying to help communities with. So we really set out to create a state-of-the-art updated training that could be done across the country. So as this new funding came out, they emphasized 4 things. There's the need to fund and facilitate, and really want to emphasize how do you get the most value for each dollar. Second is to coordinate and collaborate. And here the need is to get much better at system leadership and collective impact. The third theme that was mentioned was to monitor and evaluate. And for sustainability, we want to make investments in ways that help meet needs for the long term and create sustainable partnerships, not just spend the money and things fade away when the money ends. It also, in the notice of funding, it talked about 3 principles: data and evidence. And again, that comes back to upgrading evaluation practices, diversity and health equity. And here we'll be talking about prioritizing strategies at scale to reduce disparities, not just measuring and doing reports about inequity, but really making improvements. And again, the need for partnerships to get much better at system leadership and collective impact. So to do that, we really we want to emphasize high impact approaches to developing the public health workforce that can at the same time strengthen the skills in the community of the organizations you need to be partnering with and the funders who should be working more closely together. But within public health departments, who this $3 billion for workforce development is targeted, there's going to be many staff who are going to need training on strategic skills and evaluation. You're going to have new hires enabled by this new money, and many of those people will come from non-traditional backgrounds, so they're going to need a lot of training. And that's going to happen. You're going to have people coming in and out over the next several years to try, as you try to get more diversity and inclusion in your workforce. Also, your existing staff, there's a need to upskill, to inspire and retrain and retain both. So we're going to be sharing about how to invest in training that can be used at scale and be used over time, not just spending your money on having a trainer come in and do a workshop in early next year and then the money's gone. Also considering that many states and many communities have very similar needs. They have a lot of people who will be coming in who will have similar needs. So that can be leveraged through mass training that can allow those dollars to go further. And combine cutting edge e-learning with group coaching and peer learning as people are going through this journey together. And especially as we think about the community partners, share training programs with community partners to build coalition capacity, including what kind of strategies, how can we work together, what kind of measures, what kind of action plans, guides, lessons learned. So much can be shared that the public health workforce is developing those leadership skills, but they're using the e-learning and the sharing platforms to bring along the rest of the community. So there's high impact e-learning and online group coaching taught by thought leaders. Over the last few years, I've been building the relationships for longer than that, but really been pulling in people who are the thought leaders in evaluation, system thinking, collective impact, to have them work to put together an integrated set and an integrated approach that leverages the best of these concepts. So we have an e-learning course, and I'm encouraging you to go through. We're giving about the first hour of this. It's about a 4-hour course at no cost. Anyone who fills out the evaluation, you can get access to the first 8 videos. And these are people like Michael Quinn Patton, David Peter Stroh. And again, this is training you can share with your community partners. So I'm one of the instructors. For those of you that don't know me, I've been doing a lot of work in solving population health problems through collaboration. I wrote chapter 22 in that book, Implementing Population Health Strategies. Been involved at all with evaluation. You're probably familiar with Michael Quinn Patton, kind of the grandfather of evaluation, who's written several books, including the book on developmental evaluation, and is really leading now work towards transforming evaluation in order to evaluate transformation. Liz Weaver is the co-CEO of the Tamarack Institute, one of the most outstanding organizations around the country working on collective impact, community engagement, collaboration, innovation, and evaluation. David Stroh, who worked with Peter Senge before he wrote the book Fifth Discipline, doing the early work on system thinking. He wrote the book System Thinking for Social Change and is the leader of the Academy for Systems Change. And Nora Murphy, who's on this, one of our presenters today, the National Academy of Public Administration had a report that came out in 2020 called Enhancing Public Governance, talking about how do you address these wicked complex problems. And John M. Bryson was a key co-author and one of our faculty for the e-learning curriculum. And this report was recommendations for the federal government's Office of Management and Budget on how they should focus their spending to be more effective, and guidance for state and local governments with an emphasis on strategy mapping, one of the core parts of this training program. So this is cutting edge stuff. And so our recommendation is that the state health departments or the local health departments, as the money flows to them, include money for state-of-the-art e-learning courses in their budget. If you want to do that, we can help provide some language for that. And then integrate the e-learning into your workforce development plans for the public health staff, and then share it with your collective impact coalitions. So this builds the coalition muscle in your community.